I'm Stacy Tisdale for Howdini. When you're pregnant, all sorts of maddening things can happen to your body. Swelling, sleeplessness, and even constipation, which can make us very uncomfortable. But there are things that you can do to deal with this. Joining us to discuss those things, Dr. Keith Eddleman, Director of Obstetrics at Mount Sinai Hospital in New York, and author of 2 books, including Pregnancy for Dummies. Thanks for joining us. Dr. Eddleman, why do pregnant women have such problems with constipation?
Well, there are a couple different reasons. Probably first and foremost is a hormone called progesterone, which is produced very early in the pregnancy to actually support the pregnancy. But one of the side effects it has, it can actually slow down the speed with which things go through your intestinal tract. So it can lead to an increase in the constipation. The second thing is that many women are taking iron during pregnancy to help keep their blood counts up because the baby needs extra iron to build red blood cells. And unfortunately, a side effect of iron is that also causes you to be constipated. So when you put the two together, it can really be a problem when you're pregnant.
What are some of the things that we can do about this? I mean, you have to take your prenatal vitamins.
Well, the things that your mom told you when you were a kid: eat lots of high fiber, eat lots of food with fiber, green leafy vegetables, things like that. Some women ultimately need stool softeners that you can get over the counter, and that's not something that's harmful for the fetus at all, so you should take that if you have a chronic problem with constipation. And occasionally women need stronger medication to help with that.
So that's a big concern among women. Can I take these over the counter medicines? Would you say that's fine?
The over-the-counter medicines that are available now are fine and safe to take. Most of them work by, sort of locally. They stay within the bowel. They stay within your intestines. So they really appreciable amounts don't get to the baby or the fetus itself. So they're really not a problem. If you have a question, though, you should talk to your doctor or your provider to ask him or her about the medications.
When do I know I'm having a problem versus just normal constipation?
If it's uncomfortable for you, that's a problem. You want to be as comfortable as you can. The average individual has 1 bowel movement per day, and if you find that you're going for 3 days without having a bowel movement, that's not typical. And eventually you're going to get uncomfortable. You might not be at that point, but I'd use that as a barometer. If you notice that you're not having a daily bowel movement, then maybe you want to do something to help things along.
And can women expect this to last throughout the entire pregnancy?
Unfortunately, it usually does because progesterone is elevated throughout the whole pregnancy, and you're taking iron throughout the whole pregnancy usually. And then as the baby gets bigger too, you just have pressure of the baby and the uterus on the intestines too that sort of compounds the problem also toward the latter part of pregnancy. So unfortunately, it's usually throughout the whole pregnancy.
So get used to it and just keep a close watch to see if it's normal or something that you should be concerned about.
Well, you don't necessarily have to get used to it. There are things that you can do to make it better, some of the things that we talked about earlier. So I wouldn't just accept the fact that I'm constipated. I would try to do something to make it go away, to improve it.
Great advice. Dr. Eddleman, thank you so much for joining Howdini.
Thank you.